Hello, I'm Dr. Pamela Ruegg, Extension Milk Quality Veterinarian for the University of Wisconsin-Madison. And today we're starting part 2 in our 3-part series about antibiotic usage in dairy cows. The topic today is allowable drug usage on U.S. dairy farms. Now, treatment and control of disease on dairy farms seems like it should be straightforward, but it can be confusing. In fact, even very simple things like the definition of a lactating cow is not straightforward. Those of us who work in the dairy industry consider a lactating cow to be a cow that's producing milk. The FDA has a completely different definition of a lactating cow. In the eyes of the FDA and for the purposes of drug regulation, a lactating cow is defined strictly on age. Any animal 20 months of age or older is considered to be a lactating cow, and the rules for use of drugs in lactating cows would apply to those animals even if they're not lactating. So many of these rules are confusing, and in this episode we will review the different types of allowable drug usage that we can have on our dairy farms. So one of the simplest types of allowable drug usage on our dairy farms in the U.S. is what we call over-the-counter drugs. Now, there aren't very many of these drugs, but there are a few of them. They tend to be older drugs that have been around for many, many years and are very familiar to farmers and animal caretakers. An over-the-counter drug can be purchased without a veterinary prescription. However, that drug can only be used exactly as the label indicates. Now that means you have to read the labels. If it is not used according to the label, then that over-the-counter drug is no longer considered legally over-the-counter. That drug then would require a prescription for extra label usage. Now let me give you an example. Procaine penicillin G, many types of this are available as over-the-counter drug. Most of the time, the label on these over-the-counter Procaine Pen G bottles have an indication for bacterial pneumonia. The dosage on the label is typically 3,000 international units per pound, meaning it's about 1 cc per 100 pounds. The label typically says you must administer this intramuscular with no more than 10 cc's given in one site, and it should not be given for any more than 4 days. Now, when those conditions are exactly followed, that's considered over-the-counter, allowable over-the-counter usage. Any deviation from any of those, and that drug then requires a prescription. So, for example, if you give the same dosage, but not for bacterial pneumonia, for mastitis or metritis, that is not allowable usage of this product. If you give 15 cc's in one site rather than 10 cc's, that's not allowable usage. And if you give it for 5 rather than 4, that's not allowable over-the-counter usage. The take-home on over-the-counter is the usage must be exactly as the label indicates. Another type of allowable drug usage is what we call prescription usage. Now, prescription drugs cannot be purchased without a veterinary prescription. But just like over-the-counter drugs, when you purchase a prescription drug, that usage must be exactly as the label indicates. If that prescription drug is not used exactly according to the label, then that drug would require a veterinary label and supervision by a veterinarian for extra label usage. Now let's talk about a very common prescription drug and how we can make mistakes with that. I'm going to talk about Banamine. That's a trade name for flunixin meglumine, an anti-inflammatory. On the label for Banamine, they've got an indication for fever associated with bovine respiratory disease, endotoxemia and acute bovine mastitis, and control of inflammation in endotoxemia. The usage of that drug for prescription usage can only be administered for those indications. The dosage on the label is 1 to 2 mLs per 100 pounds, and it must be given by IV administration. If all of the indication, the dosage, and the administration is followed exactly as that label says, then the meat withhold is 4 days and the milk withhold is 36 hours. If that product is administered in a different way, then those meat and milk withholds are no longer valid. So if that drug, Banamine, was given intramuscular instead of IV as the label indicates, we have a dramatic impact on the meat and milk withholding. Instead of the meat withholding being 4 days for IV administration, the meat withholding goes up to 30 days. When you look at the milk discard period, instead of it being 36 hours, it goes to 72 hours. So we have to be aware that when we have prescription drug usage, the label has to be exactly followed. Now, the final type of allowable drug usage is what we call extra label drug usage. This is a legal way to use drugs, but when we use drugs in an extra label fashion, there's some very particular rules that must be followed. Now, extra label drug usage is defined as any administration of a product that does not exactly follow the label indications and dosage. So if there's a different dosage, 3 cc's instead of 1 cc, a different frequency, twice a day instead of what if the label said once a day, a different route, such as IM versus intramuscular, a different animal or a different disease, like the use of a drug to treat mastitis when the label says metritis, all of those examples would constitute extra label drug usage. So if we come back to our example that we used earlier about procaine penicillin G, the label states 1 cc per 100 pounds. So extra label usage would be 3 cc's per 100. Extra label usage would be if you gave this drug for greater than 4 days, or if you gave it for the treatment of metritis or mastitis or some other non-label indication. So extra label usage is not allowed for all drugs and has very specific rules regulating when it can be used. Extra label drug usage is permitted only under the supervision of veterinarian. It's allowed only for FDA-approved animal and human drugs, and it is not allowed for non-approved compounds, including botanicals, which you may not even really recognize as a drug. The veterinarian who is supervising the drug usage must have the valid veterinary client-patient relationship that we discussed in episode 1 of this series. Extra label drug usage is allowed only for therapeutic purposes. It cannot be used for production usages. Extra label drug usage cannot be administered in feed, and extra label drug usage is not permitted if it results in a violative food residue. So extra label drug usage requires a prescribing veterinarian. That veterinarian must put an appropriate label on the drug, and then there's also a requirement that appropriate records are kept to identify those animals. The records must include the animal and the species, the condition being treated, the name of the drug and active ingredient, the dosage, the duration of treatment, the withdrawal, withholding, and discard times, and those records must be kept for 2 years. If there would be some sort of audit of the farm regarding drug usage, or if there was a violative residue, the FDA may request to review those records to make sure that the extra label drug rules were properly applied. Now, we've just reviewed the allowable drug usage on dairy farms, but we must also recognize that not all drugs can be used in dairy cows even by veterinarians. There is a list of drugs that are prohibited by the FDA for use in food animals. Those drugs that are on the prohibited list include diethylstilbestrol, chloramphenicol, nitromidazoles, nitrofurans, clenbuterol, dipyrone, glycopeptides, gentian violet, and phenylbutazone in adult dairy cows. Now there's also kind of a confusing class of drugs that can be used according to their label, but they are prohibited from extra label usage in food producing animals. And probably the most confusing of these is the use of sulfonamides in adult dairy cattle. So sulfonamides can only be used exactly as the label specifies. And relative to dairy cattle, most of the available sulfonamides are labeled for treatment of pneumonia and foot rot. And they cannot be used to treat any other condition, even by a veterinarian. So they are prohibited from extra label usage. The other drugs that are prohibited from extra label usage in food producing animals are fluoroquinolones such as Baytril or A180. In episode 2 of this series, we've been discussing the forms of allowable drug usage on dairy farms. Those types of usage include over-the-counter drugs, prescription drugs, and extra label drugs. We also have to understand that there's a whole class of drugs and forms of administration which also are simply not allowed usages. On a practical basis, the easiest way to implement good practices to ensure the responsible usage of drugs is to make sure that you read, understand, and follow the labels for every drug used on your farm. And when you have any questions about either any of these forms, the over-the-counter, the prescription, or the extra label, be sure that you ask your veterinarian for advice. And that advice can include things like withholding periods, administration route, and the definition of if an animal is a lactating or non-lactating animal. Now in the final part of this 3-part series, we're going to talk about the procedures and mechanisms that we can put in place on our farms to ensure that we minimize the risk of having residues.